Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Clomipramine. Its brand name is Anafranil. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Clomipramine is a dibenzazepine tricyclic antidepressant. Its exact mechanism of action is still currently unknown. However, its ability to block the reuptake of serotonin, or 5-HT, is thought to be very important in how it works. In terms of indications for use, we do see clomipramine used in the treatment of obsessive compulsive disorder, or OCD. We do see it used occasionally in the treatment of depression. Some ejaculatory disorders can be treated with clomipramine. It is sometimes seen used in the treatment of panic disorder. And lastly, in autism spectrum disorder. Now, before somebody was to use clomipramine or anafranil, there are some contraindications they must clear, as well as some precautions and warnings that they should be made aware of. This medication would be contraindicated in any patients who have used a monoamine oxidase inhibitor in the previous 14 days. If a patient had a hypersensitivity to clomipramine or other tricyclic antidepressants, they would not be able to use this medication. And lastly, for contraindications, clomipramine cannot be used during the acute recovery phase following a myocardial infarction or heart attack. Now, in terms of precautions, clomipramine is on the Beers criteria, which is the list of medications that the elderly population should either avoid or use cautiously. The high prevalence of anticholinergic side effects, as well as the sedating effects that this medication may cause in the elderly population, could sometimes lead to falls, and in this population, falls sometimes lead to fractures. Patients with pre-existing cardiovascular disease who use clomipramine may put themselves at an increased risk of experiencing hypotension or low blood pressure, as well as tachycardia. Patients with adrenal neoplasm who use this medication may be putting themselves at an increased risk of experiencing a hypertensive crisis. Cardiac toxicity may occur in patients using clomipramine who have hyperthyroidism, or in patients who are using thyroid medications. There is a risk of experiencing serotonin syndrome with the use of clomipramine. However, the risk would be increased if patients were using it with other medications that also affect serotonin levels. If a patient is using clomipramine and is to undergo electroconvulsive therapy, there may be an increased risk of hazards associated with the ECT. Patients should be made aware that hyperthermia has been reported with the use of clomipramine or anafranil. Some patients may experience significant weight gain, so this could be very important for some patients and they should be made aware of this before starting the medication. Thrombocytopenia, agranulocytosis, and leukopenia have all been reported with the use of clomipramine. Fatal or severe hepatic injury has occurred in patients using clomipramine, so patients that have hepatic impairment should be closely monitored. Drug reactions with eosinophilia and systemic symptoms have been reported, also known as DRESS. The medication may have to be stopped if any signs of this do occur. Patients should be made aware that seizures have occurred in patients using clomipramine. They would be at more risk of experiencing a seizure if they have conditions that lower the seizure threshold, or if they're using other medications that lower the seizure threshold. Because of the anticholinergic side effects, this medication should be used cautiously in patients who have an elevated intraocular pressure or in those who have glaucoma. This medication should be used cautiously in patients who have bipolar disorder, as antidepressants in general may increase the risk of experiencing a mixed episode or manic episode in those individuals. Neuropsychiatric signs and symptoms, such as hallucinations, paranoia, or confusion, have all been reported. Patients with a history of urinary retention would have to use this medication cautiously because, again, of those anticholinergic side effects. It's recommended that this medication be discontinued prior to an elective surgery. And finally, patients should just be made aware not to stop the medication abruptly, so it should be tapered off slowly when discontinuation is necessary. Once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use clomipramine or anafranil, they can expect to receive their dose in capsule form. So when somebody is using this medication for its on-label use in OCD or obsessive compulsive disorder, the initial dose would typically be 25 milligrams daily. The dose can then be increased over the first 2 weeks to 100 milligrams daily, and the maximum dose, according to the FDA, would be 250 milligrams daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using clomipramine, so I'll go over some of those here now. Diaphoresis may happen between 9 and 29% of the time. About 18% of patients notice an increase in their weight. Constipation can happen between 22 and 47% of the time. Diarrhea at 13%. Indigestion at 22%. Loss of appetite comes in between 12 and 22%. Nausea can happen up to 33% of the time. And xerostoma may occur between 63 and 84% of the time. 13% of patients may experience some muscle pain. Up to 54% of patients may notice dizziness. And between 2 and 18% of patients may notice a feeling of nervousness. Headache comes in between 28 and 52%. Up to 25% of patients may experience insomnia. Tremors can happen between 33 and 54% of the time. And abnormal vision can happen 7% in pediatrics and 18% in adults. 14% may experience a disorder of the urinary system. And about 20% may experience erectile dysfunction. 21% may notice a change in libido. Between 6 and 42% may experience a disorder with ejaculation. More serious side effects would be orthostatic hypotension, which comes in between 4 and 6%, hyperglycemia, or increase in blood sugar, an increase in core body temperature, granulocytosis, and finally, suicidal thoughts. That's all we're going to talk about today with clomipramine or Anafranil. As always, I'm very thankful you took the time to come by and watch one of my videos. If you did find the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.